So like I said in the beginning, I've been to many different osteos, physios, and all these therapies. You specialize in FCS.
Fascial Counterstrain.
I want you to explain it to me. Why is it different to a lot of osteos, and why don't many people know about it?
FCS is the new development which was developed by Brian Tuckey. He's a physiotherapist who was trained by Dr. Lawrence Jones in US. And he's an osteopath, which is the second generation osteopath or third generation osteopath. He came up with the idea of counterstrain. And there's a story behind it that he used to do the same thing, cracking, or the HVLA, high velocity technique. He had a patient who came who couldn't stand straight. And he was in so much pain he couldn't go to sleep. And Dr. Jones, he tried his best to treat him. And he still couldn't do anything. He thought that he was better manipulator than the chiropractors the guy was seeing, but to no avail. So the guy said, look, we are not getting anywhere, at least find me a position that I can comfortably sleep in, and maybe that will give me some relief. So Dr. Jones put up some pillows, propped him up into a different kind of very weird position, and the guy went to sleep. He didn't have the heart to wake him up, so he went and treated another patient into the other room.
How long did he leave him for?
30 minutes.
30 minutes.
30 minutes later,
In a certain position.
In a certain position. He came back, and the guy got up straight, no pain.
Just gone.
Just gone. The pain was gone. So somebody like us, we will just say, oh yeah, bingo, that's it, done. See you later. Jones went on to a hunting journey. He said, if that could have been done, that means there is something to it.
Yeah.
So the rest of his life, I think this was in something about in 1945 or something. And he went all the way on 1950s. I can't remember exact date when he started on this journey till his passing, which was 1998. He actually did a lot more on the counterstrain. So he developed a lot of these points and whatnot. So
it's very different.
It's actually part of the osteopathy. So the premise was that any dysfunction in the body will create a tender point, and that could be a distal to the point, the origin of the pain, or not the origin of where the pain is at the moment.
Yeah.
So the tender point can be caused, let's say, for example, if you are bending forward and in pain, and you're having pain in the back, the premise is because body hugs the lesion. So you're bending forward, so you're folding over, the tender point will be at the front. Dysfunction is at the front because you're trying to protect it.
Yes.
When we get an injury in the hand, we try to protect it.
Yeah.
And we go like that.
Wait, is that like a mechanism in the body?
Well, that's a self-mechanism, self-healing protocol, right?
Because, you would hit your toe and then you would...
Yes, you will bring it.
Yeah.
Because you will bring it closer.
That's crazy.
So to his credit, he actually developed those originally 200 points, tender points he came up with, which was on the spine and all the areas. And it was a very successful modality. He would use the motion testing, and then he will go and check all of these tender points. After his passing, his student, because he only gave 4 people who were certified to teach after him.
Okay.
So he was a very strict teacher. Old school. You have to actually be at a certain level to pass that his qualification criteria. So he allowed 4. Brian Tuckey was one of them. And Brian came up with, once he was, again, by accident, as he was treating someone, and he freed up something on the mastoid process, which is next to the ear, like on the occiput, next to the occiput. And the mastoid process went really soft. And this is, he's treating someone in the gut area.
Wow. So the pain's here.
And something from here released that, which got him thinking. And then he went into research.
More further stuff.
So he came up with the cranial scan. And that is...
What's a cranial scan?
Cranial scan is that everything in the body will as we have tender points in the body,
Yeah.
a system of those tender points. Let's say if you have ligamentous problem, you will have tender point this cranial scan on the head as well.
Wow. Tender points is like certain touch points.
So tender points are particular points that are tender to touch. They are edematous. They're like a rise of grain, if you may.
Okay.
That's where when you normally have an injury somewhere, you will find that those tender points all over the place in your body. And even when you're not in pain, you'll have those tender points.
Wow.
So these tender points, they are created because once you have a dysfunction, the body is trying to compensate, and it will somehow, because the inflammation goes in there, it creates that tender point because the feedback to the spinal cord and then to the brain,
Yeah.
and those tender points are the one they are dictating that. So what we do is we monitor those tender points. Brian has come up with a method that every tender point he has linked to a cranial scan.
Okay.
So from 200 tender points, we have gone up to somewhere about now, I think 1,500 or something, and increasing. So it is in development still. We are
Still in development.
yeah. So we are into brain now. We're actually treating brain stuff that is even next level.
Because I've seen a lot of it on YouTube, and it was kind of if you want to open up Davey, FCS on YouTube and just write osteo next to it. It's very not much needling, not much hands-on, and to myself I was like,
Not it's hands on.
but not as much as like rubbing and
not rubbing, yeah.
massaging, yeah. And it tripped me out because I was thinking to myself, I was like, this is very different
Yes.
because normally if I go to a back pain, he's rubbing it,
Yeah.
but now there's no rubbing.
Yeah. That's Brian Tucky there.
Which one is that?
Now go down.
Go down.
A little bit more there.
This one
That's
here?
Brian Tucky. Yeah.
Yeah.
And it was just odd. And I'm like to myself, hold up. This is either fake or bullshit, or this is hypnotizing. It's one of the two. Because there's not much information about it,
Right.
and it's very different. So what's the evidence on this? Have the studies evidence on
So
this?
the evidence at the moment, because the studies, obviously scientific studies, if somebody wants to do the research, that will take about 15 to 20 years. That's normal. That's actually normal. That's,
On this?
on every single technique when they do it. So whenever the method is there, it will take 15 to 20 years because you have to get the study sample, then you have to get the funding, you have to go all that. It's a again, at the end of the day, it's more about economy
Yes.
than thinking about the patient. So the only time we see things getting a little bit past rush was when the COVID vaccine was passed through
Oh, yeah.
without much trial.
started off that.
But that was the only time.
Davey. Bloody hell. Take that. But what is this made
Yeah,
of?
let's talk about COVID, yeah.
Oh, yeah. It was. We're going to get to that. So I wonder if we're going to talk to that. But I just find it very, very fascinating.
If you go to counterstrain.com.au, I've actually put some videos on there.
Yeah. Go to Counterstrain.
Counterstrain, yeah.
Counterstrain.com.au. Well, that's a website that we have for the people who are doing the courses.
Very different.
It is,
very, very different.
and the videos are.
Is it this one here? Yep.
Yep.
And go to the course. These are just the courses. So if you go, these are different courses that we are doing. Diagnostics.
So you're also teaching this stuff?
Yes. So I'm the taking care of the Counterstrain courses in Australia.
Wow.
So Brian Tucky has what you call mentored me quite a bit. It still mentors. So this is one of the patients that Brian's treated. This was my first video that I watched.
What
emailed.
problem does he have here?
So this is the intentional tremors.
Okay.
And I'll tell you, and the patient that I had was actually worse than that. She has intentional tremor, but she was diagnosed here with Parkinson, unfortunately.
Wow. That's a lot of shaking.
Yeah, so that's on the left side, it reduced. That's just
Yeah.
after 15 minutes.
You can see the difference.
And then the second, and the funny part about that is the guy actually wear the same shirt on all 3 different appointments. So you can see.
Wow.
And that's his hands now.
Wow.
So that's the intentional tremors that he had. So Brian did in this case was, you can see there's a little bit on the right side, and it's pretty stable to where it was before.
Okay.
So Brian actually treated his epidural plexus in the cervical spine that is going into the C1, C2, C3, which affects the brain as well. So the congestion over there, and he treated that.
So it was more of a brain problem.
Well, it was more of a lymphatic problem, which was causing the pressure on the brain, and now you can see the hands are pretty stable. And that's so that's what he did. And the good thing is about, as you said, about the studies or what we had in terms of the experience, this is reproducible. So I have done on a similar case, which she had intentional tremors, was diagnosed with Parkinson.
Wow. Parkinson's pretty serious as well.
Parkinson's pretty serious. So like when she came in actually for lower back pain. And I said, would you, because we have a method of diagnostics, that took me to the C1, C2, C3. And would you mind if I just treat that? And she goes, yeah. Now, I started treating that because I'm still concentrating on the lower back pain. The husband goes to me, he goes, oh, look, what happened there? I'm like, I'm not sure what you're referring to because I'm still thinking, oh, okay, the neck and the back. He goes, her hands are not shaking anymore. So when she was sitting down or lying down, her hand was constantly moving like that because she couldn't hold any cup of tea or nothing at all. And 30 minutes into the appointment, that was stable.
That's pretty
When she, well, it was.
Surely you get people calling you a magician.
I don't want them calling.
That's magic. 30 minutes later, that's crazy.
But the funny thing was, because when she asked me, she goes, you fix my hands. Is it Parkinson gone? I said, look, no, I'm not fixing Parkinson. I said, maybe you are misdiagnosed. I said, that's my that's my guess. Because the lady, she had actually a very severe car accident. And that car accident might have actually
Affected the neck.
the neck. And that's where the entire thing started.
It kind of like how you said that.
Wow.
Misdiagnosed.
I mean, it's amazing, isn't it? Like you don't think about the repercussions for someone when they're misdiagnosed with something like Parkinson's. You know, you then believe you have that for the rest of your life.
Yeah.
Which is life altering, isn't it? You know?
Well, it was life altering for her because she said, can I come off my medication? I'm like, I'm not saying nothing about that because that's not my field. So you got to go to your GP. You got to go to your specialist. Funny enough, 9 years later, she found a good GP who sent her to a specialist. 9 years up until that time, she was still taking medications for Parkinson because the GP she was seeing didn't send her to the specialist. She went to see the specialist. He did the test and he said, you have no Parkinson.
Wow.
So that's about 15, 20 years of Parkinson medication.
Do you reckon that's a big problem nowadays with a lot of practitioners? Misguiding people and telling them they have this problem and that problem?
I wouldn't say misguiding because you can only go to you can only go up to the limit which you have set for yourself.
Okay.
So if you are going to have, because I genuinely believe that all the practitioners who go into the health field, with the exceptions of the few, they do go to help people. That's my belief because they actually do want to help people. Now, the way the system trains them, that's when you get the blinkers on.
Okay.
So you started to see in a certain way. And when you start seeing in a certain way, you start looking at the problems in a certain way.
What do you feel like is a big problem now with a lot of physiotherapists and osteos? And
I think it's the education that is being delivered at the moment.
because they're all fighting each other.
It's
He's that. He does this wrong. Physio's rubbish. Osteo's rubbish.
Yeah. For me, more money. That's all.
For me, it's a very simple thing. What I suggest to my patients whenever somebody comes, but as I'm treating them, I actually do educate them. I said, so we are doing this test because it does this. We are doing this test because it does this. So you become kind of like a knowledgeable person about your condition. See, now you will never forget that anyone who has a lower back pain, that you're going to ask them whether your back is hurting when you're sitting down or you're standing.
Yeah.
So what I just did there,
Yeah. He don't know got that question.
well, it just actually got you educated on that part.
Yeah.
He's healed you already.
Yeah.
So 3-minute conversation of you.
Pain's gone.
No, the back pain is not going. It's being diagnosed. So that means that something was coming into the knee area, ankle area, or the hip area that was causing your pain. So now you understand that. So now you will start looking at it. Okay, which leg hurts more when I'm standing? Did I have an injury long time ago on the legs? Did I have a fall? Did I have something where I might have actually just accidentally hit my knee somewhere? My meniscus is damaged, or my ACL is a little bit, there's a tear or something, or whatnot. You can have any dysfunction. Is there an arterial problem? Is there a lymphatic problem? Is there a superficial fascia problem? So the FCS, in essence, is every single system of the body that we have actually got, and we put it together, and we have 6 ways of diagnosing. All 6 ways should tell us this, then we treat.
What are the 6?
So the first one is the subjective history, that everybody does that. All the practitioners will do that. The second one, we'll do joint oscillation testing, or we have the functional, depending on the order you can change. You will do a functional test. Let's say, for example, that could be if somebody is coming with the numbness in the hand or whatnot, I'll do upper extremity tension test, nerve tension test, which is just, let's say, for example, if I want to check someone have a median nerve problem, I will extend the arm and then I'll push it that way.
Okay.
If it is not going past, it should be able to go past 30 degrees. And that's actually that brachial plexus demo by Brian Tuckey. If you look at that, that's that. It will show you that. On top, Timothy Hodges, who is the second in command in the FCS community. So he's the instructor as well. Both of them are a very good friend of mine. Tim actually will do SLR or straight leg raise test to see
How far your foot?
Yeah, and then he will diagnose somebody with the FCS visceral condition. He didn't do the joint oscillation motion testing over there because he just went quickly. That's already been done for the purpose of video. You don't want to make a 30 minutes video.
Yeah.
But he's done that, and then he does the cranial scan, and then he treat it, and then you get it all the way in one go. So this is a guy who would have had lower back pain for a very long time, diagnosed with sciatic nerve. Misdiagnosed, sorry.
What's sciatic?
Sciatic nerve is one of the biggest nerve in the body that very often misdiagnosed.
It runs down the back of your leg, right? Like back and then goes down your leg.
Yeah. So it goes all the way and hit the knee.
That's right.
And it's very painful. I've seen people excruciatingly in pain for many years. But misdiagnosed nevertheless.
And he was one of them.
He's one of them. I actually have done...
Which one are we looking at? This one here, is it?
This one, yeah.
This one, yeah.
So... So this is a straight leg raise where you actually hold the leg and go up. And this is where he starts wincing. As you see that tension, his leg stopped right there because he's in pain. If you do that, that means the nerve is... you're putting the stretch on the nerve and it will become even more painful. It's a very good test. That's the first thing. And so Tim is asking somebody else to do that test now. So just in case if people are skeptical that we are doing it just for the reason, for the sake of it.
So would you say in the last 70 years, this has kind of evolved this path from osteo?
So osteopaths so the original osteopaths, they were very successful.
Okay.
The profession was actually going against the mainstream medicine, and then it became famous. So there was a reason for it. They built a train station for the founder of osteopathy, where he was. Next to his clinic, they built a train station. So the guy needs to have some skills for the government to actually build that train station there.
Yeah.
Then the second generation, they were great. Third generation, great. And then there was a decline of osteopathy in US. So I'm talking US context. So the entire osteopathic profession started going towards medical, where they start prescribing medications. And
even osteos?
Well, in America, osteopaths are considered physicians.
Okay.
So
So
they're physicians because the training is pretty much the same, except for that they can use manual therapy.
People really underestimate how much education osteos have.
It's 5 years, and
It's
you learn
a lot about the body.
a lot. I mean, I'm still learning. I'll say that I still learn. I will go home when I finish my practice. If anything, there is like I'll read some books, and I'll have some of the anatomy books, some of the older books. So most of the things are, and then I'm talking with Brian and Tim. Hey Tim, what do you think? Anything like this is this? If there is a case that I can't understand,
Constantly
there's
evolving.
constant evolving. Yeah.
So you feel like, yep, sorry.
No Netflix then.
Definitely no Netflix in this guy.
I'm not sure how people can find the time. Like, even if the Netflix is on, it's just like you just do the book, and it's like, oh, this is interesting.
Far more interesting.
Far more interesting than that.
Yeah, you wouldn't get much free time to yourself.
My free time is when I'm reading a book.
Wow. Yeah.
Because I actually gain energy from it in terms of when something clicks in the brain,
Knowledge.
you actually get excited. So I really love it when you get something and you're like, oh yeah, just figure this out. And that is, for me, is one of the biggest thing. Like that straight leg raise test and what he did right over there, once he treats it, you will see, and that's just took about 3 minutes roughly, and you will see his straight leg raise, how it will improve.
It's crazy because when I look at this, when I see some of these videos, I'm just like to myself, this sounds crazy.
Yeah.
This is impossible. To me, I started thinking that, is this guy hypnotizing people? You know, and then I started thinking to myself, it is, you know, because that's what you think it is.
Yeah.
Because
it's such a short amount of time, right?
Yeah.
But it takes, sure.
it's very different to normal osteo. Because normal osteo, I don't know, they're rubbing, they're needling.
A lot of cracking as well.
My question would be, what's the difference between an osteopath and a massage therapist? A massage therapist can rub you,
Yeah.
can do the cupping, can do the dry needling, can crack you. So what's the difference? So this is one of the things that, and look at that straight leg raise. That's gone all the way there. And
he couldn't do that 3 minutes ago.
yeah. Not
So would you say with your kind of clinic and expertise, a lot of it is dealt with the brain?
Well, brain is involved. So you have the brain. So you got the peripheral.
Yep.
You got the spinal cord, and then you got the brain, right? So you've got three different set of neurons that are going all the way for the pain, for the nociceptions, right? All the technical terminology, which I won't bore you with. But you got all these. So you got the brain involved, you got the spinal cord, and you got the periphery, which is all the other stuff. Depending on where the original issue is, once you treat that, the original, that if it is in the brain, you have to treat the brain.
Okay.
If it is in the spinal cord, you have to treat the spinal cord.
And how do we get into the brain? Because obviously the brain is...
So the brain it's the same way. Now, people think because there's a hard skull there.
Yeah, that's what I'll think,
Right.
yeah.
So how many people actually know that the bones are actually very light? They're not heavy at all.
Yeah, yeah. Oh,
Right?
Yeah, yeah, it's true.
So
I like.
if you can sync and do the same thing here, the head is not any different.
Yeah.
You actually, in manual therapy, and this is regardless of FCS or anything, every manual therapist, they're able to palpate through the layers, and they can go through layers.
Do we have layers in the brain?
Well, you got the skin, you got the layers, as in you got
The tissue and
the tissue, then you got the cranium, then you got the there will be veins, the arteries, you got the frontal lobe, and
that's all accessible just with touch.
well, just with touch. Well, that's where the manual therapy is based upon. Scientific studies, you can actually one day when I'll have enough funds, maybe they can perform some studies where you can actually compress, or you have some kind of transmitter in the brain where you can actually compress and see if you can reach the pressure all the way through.
Wow.
It's a similar to if you have a concussion.
Yes.
And they did a study in US where every time you have a concussion, your thalamus and the internal brain structures, they actually do get shaken up, even though they're in the hard skull. So why can't you do a gentle manipulation of the same structure or sync through the layers and reach the same structures?
So would you say sometimes as well with your work, like with your kind of therapy, that you manipulate the brain in thinking differently?
What we are doing is, if we have so in particular to FCS, we will monitor a tender point. That will tell us that there is a problem with the dura. Now, have we done a scientific study for it? No. But have we reproduced it over and over? Yes. because Brian can do it, Tim can do it, I can do it, all our students can do it who have learned it. And so over and over, reproducibility, that means it might be what it is. And as we are doing all that, and everybody will say, okay, this is a tender point. I mean, for an example, if we were to check, so this is just a very quick one, if I can borrow your hand for a minute, and I was to do motion testing here, that motion testing is pretty good. Yeah. So the motion testing is pretty good here.
Yeah.
The second one, there's a little bit of resistance there. You can feel that. And then the third one, there's a lot more rigidity. So this one doesn't have as much flexibility as this one has. Now you will say that this is the bigger finger, this is the smaller finger, maybe it's that. But if I was to find that there is a tender point somewhere, and now his smile is getting a little bit more smiley because I just found a tender point here. And then I check that. So
Magic, eh? So the ears like healing hands.
no, so he's actually got a tender point here. That tender point is right around here. And you see he's smiling. He's not actually smiling.
Yeah.
It's a grimace, small.
So that's one way of finding out when we say that tender point is when the patient will make a grimace.
Yeah, absolutely. Of course, yeah.
It-
Reaction, right?
And he will tell you that it's about 4, 5, 6 times tender than any other part. This is quite tender. And what that does, because his body is trying to protect it, the motion testing, if I let go, his motion testing gets stuck again. If I do this, his motion improves.
Wow, that's crazy.
Now, what that can cause, if you were to look at osteopathically, so osteopathically, and as we do in FCS community, that we have this which can cause parasympathetic or sympathetic connection all the way to the body, where the reflexology comes in as well. So osteopathically, we'll say that there is a sympathetic connection there. And then your sympathetic system is in overdrive. So then that will cause some other problem in the body. So the osteopathic philosophy originally was that you can have a lesion anywhere in the body that can create a pathology somewhere else in the body. Wow. In a long run.
I want to have a go. I want to have a go.
Put
my hand up.
It's crazy. It's a very, very different, very unique.
This is what osteopathy was originally.
This is what it was originally.
So originally, osteopathy was, if I have to refer to someone, I will say Dr. Andrew Taylor Still. He said that what is osteopathy is based on anatomy.
Wow.
So the applied anatomy was a big thing for the osteopaths. You have to know your anatomy. So this one is causing, what is it? So you have to know what it is. Now, the only problem was osteopaths, when they become experienced, they can tell you what it is because they will say, oh, this feels like it's a nerve. Maybe feels like it's an artery. Maybe feels like that. FCS takes that guess out of the entire thing. So we have a cranial scan. So in his case, the cranial scan of this particular, it's a tender point. I'm thinking it's a nerve tender point. So the nerve tender point, so if you take the head off from there.
Take it off?
Take the head.
Yeah.
So all I need to do is to go to the.
Yep, grab that
I'll
mic.
just grab the mic. So just going to go to the cranial scan around here and compress that cranial scan. And I'm using another method which is called touch inhibition. So if I touch inhibit that, his tender points here will disappear. So
That's crazy.
What's going on here?
Hey, it's magic, man. I bought some.
That is incredible.
right, so
I bought some tarot cards in there. They're not scared enough.
see
This is pushing me over the edge.
When he
now.
was doing it, I was feeling pain.
Yeah.
And then when he touched my brain,
so this is a cranial scan. That's what Brian Tucky came up with.
That's insane.
This is one of the we actually do the neuroscan.
we need another one. I need another one for me. That's mind blowing.
You can actually see that nerve. This is
This one here.
this one is the nerve tender point.
Yeah.
He did that where someone's leg was not moving properly. So the positive Thomas test with the tight hip flexors, which is a very common problem in a lot of the people because of sitting and whatnot. So Thomas test, as you can see that the leg is not leg is not going all the way down. So that's a Thomas test, which is positive. Now, Brian Tucky is saying that this is due to the tight hip flexors, which are maintained due to one reason, because he's done the scan, and she is testing positive for the musculoskeletal, complaint, but nerve that is causing the dysfunction, which is MSK, or the musculoskeletal problem caused by the nerve. So in this case, he's going to treat the femoral nerve, and then he will treat the, I think it's the same one where he treats the, I think there's one more, he treats two nerves in this. One is the femoral nerve, and if I remember correctly, I think it's the femoral cutaneous nerve as well.
It's not a huge amount of pressure, right? It's not like as you said, the massage like hard rubbing and this is just pressure points, like you said, like the
So the tender point is there. Then you grab the tissue, in this case, which is a nerve. So you will actually, so lateral femoral cutaneous nerve. Yeah, I was correct in that. That one. So he actually goes to the lateral femoral cutaneous nerve. So your surface anatomy has to be really good. Your anatomy knowledge has to be really good. He's on that nerve, and he just glides it a little bit, and the inflammation goes out of those tissues.
So,
and the test is not positive anymore.
Would you say rubbing that kind of area is signaling to the brain?
Well, it's not rubbing. So what it is, in your case, which we have the tissue here, the nerve tissue, that create that tender point. Now I know that this is a nerve which is right around here. So the digital nerve that is causing this tender point to have his motion restriction. So I can actually just grab that nerve. Now I can go, oh, I don't know where the nerve is. Or if I am good enough with my anatomy, I'll go and I'll say, this is where the nerve is. That's a digital nerve. And I can just glide, and there's no tender point anymore.
Jeez.
So all I did was just grab that nerve and glide it.
Yeah, so you reposition the nerve in a sense, like you've got glide it into more into a different position.
Yeah, so you're just gliding the fascia, which is because fascia is connected to the nerve. So the nerve is going through the fascia and whatnot.
Wow.
And all the tissues that's why the fascia has effect on every single thing that you have.
I'm tripping out.
Once we do that, he actually has no problem with these.
So would you say, so this was the original osteo, and why did this kind of practice die down?
I would say the more influence from the regulatory bodies, maybe, because also it was difficult to teach. So the one thing was the osteopaths had to really train hard and so you have to have a passion for it, and you have to spend a lot of time, a lot of effort.
That's crazy,
right?
So I'm done.
Right,
I need another one of that example. You got another example for me?
We can do it. We can do it.
We need another.
Do it on me if you want.
We need another example. What do you got?
Well, depends.
David, you want to give us what do you got for us? Something that we can get on the camera here, because this is crazy. This is mind blowing. What do you got?
We can do any motion test. So, for example, because he's sitting a lot, right? That's
probably. I work at a computer a lot, so probably here, shoulder, arm, this right arm sort of area would probably be
right. So this will be a good example. So if he's right shoulder problem, so we actually do the motion testing first, or the functional test.
Okay.
So we do check his range of motion.
Yeah.
If there is, so this is part of where everyone has a therapy that you can do the every therapist should be doing that. So if we do the external rotation of the arm, and if we go all the way, that actually gets stuck right out in the end range.
Yeah.
And it's a hard stop, right? So we check if it is his normal or if it is his not normal. So this shoulder has no hard stop. This is pretty good. Whereas his right side, as soon as we raise it, it just gets stuck right there. It's a hard stop. So without going into other motions, you can't see that, but he actually has a little bit on that too, but it's not a hard stop. So there are two different kind of set of problems. Now, the first thing is, as we are going on his shoulder here, you need to check the shoulder range of motion, if there is anything wrong with the shoulder, because remember, people will think that everything in the shoulder comes from the shoulder problem, which is not true.
But it doesn't.
It doesn't.
Wow.
So as we are raising his, now there is one way of doing it. I can actually skip a lot of the steps and go straight to the thing, or I can do it properly, which is I can check. He actually doesn't have any problem with the shoulder. You can see the shoulder motion is pretty good,
Pretty good.
right? But why his shoulder is stopping
That's the
is
question.
not the shoulder anymore. Now I got to check. Could it be coming from anywhere that he's got any other issue? As I get to his forearm, there is some tenderness around this arm here. So as we are going to the forearm, there is a little bit tenderness there. Now, if that is the issue, his external rotation gets better when we do that. And he'll tell you that, yeah, it does. Right?
That is crazy.
So that,
Do you feel the difference, Davey?
Yeah. I mean, I felt it. Less pulling less.
so as we go over here, then there should be a tender point that is irritating his shoulder joint. He'll feel the pain in the shoulder joint, but the problem is coming from the forearm. Now, having said that, it could be anywhere in the spine as well. So if I was to go and I check as I'm going down all the way, so this is a little bit more painful. Now I can actually go, so we do diagnose properly. Now his forearm is not hurting anymore. Correct?
That's correct. Yeah. Okay.
Now, if we were to check his external rotation of the shoulder, and how's that now?
Yeah. But now it's fit in the back. Now I feel like the strain in the back.
Okay.
Yeah.
So he's feeling the strain at the back, not in the shoulder joint anymore.
Yeah.
Okay. So how many injuries he had?
If you don't know this guy, you've never met him. He's sure.
We're not putting you on here. No.
That's what?
So I can tell you that he's quite tender around this area,
Yeah.
right?
Yeah.
And as I'm going down, he's tender over here. So how many injuries did Dave have? We don't know, right? So we can actually, when you come to see me, I will actually relate back to his issue that he's coming in for.
So he
look
went
at
from
his
the
complaint.
shoulder.
So if he's looking for the shoulder, I can actually just treat his forearm and he'll be happy with that because his shoulder is gone. But if I'm treating like an osteopath, then I'll see that this forearm is another compensation that body has created for another lesion somewhere.
Wow.
So when I go as an osteopath and as an FCS practitioner, I will go and I'll say that he's got a lot of things going on here. Now, as we do this, his shoulder is pretty good.
Yeah.
No, not any tension.
Maybe less than when you did it the first time. Sure.
And how about now?
I just
That's more.
on my back.
Yeah.
Just that
And
spot in my spine there.
right about there. How's that now?
Yeah.
That's the best.
Yeah.
Now, this one also would have created, because he was tender around here. Any tenderness here?
Not there. Further up, I think it was.
That's all gone.
Oh my God.
Okay, so I'll be trading something like 3, 4, 5, T5.
Yeah. About there. That's where I feel a bit.
You answer this, David. Get the hell out of here. You answer this. So everything kind of connects.
Everything is connected in the body. So this is where
It's anatomy.
that's anatomy, because everybody tells you that we are treating holistically.
That's crazy.
But if you go and I started rubbing the shoulder, how much of a benefit I'm going to get from that? Shoulder is not the issue.
Yeah.
So it's kind of, yeah, I get what you mean. It's gone from connection to connection and finding the,
Go further down.
Yeah.
so everything kind of connects.
Yeah. So everything in the body is connected. Now, if I want to go a little bit more, now T5, I can go and I'll say that T5 also have some influence in the lungs area too,
Wow.
right? So the oblique fissure would be about somewhere, the oblique fissure in the lung is about at rib number 5. So if I can go and I can check, so if I go to, this is 2, 3, 4, 5. This is rib number 5. And if I go around here, you can see that that's a real tender point here. And now his back spine and everything is pretty good. Okay?
Davey, are you sure?
I feel like it's just moving the pain around my body.
Right. So if I was to literally do something, now you can tell that his shoulder is pretty much
Yeah, it's loose. Yeah.
loosened.
Back's
But that is,
now it's here.
yeah. So that's his lung oblique fissure that we need to treat
Davey,
using it.
I'm going to have a chat after this, me and you.
Having said that, this is his pain there. Now, we have a scan, cranial scan. So you notice that I'm using touch inhibition, I'm using motion testing, I'm using joint motion testing, joint oscillation testing, and I did what you call the subjective as well, because I asked him about his history, like where the pain was. And then, like, obviously, it will be a bit more detailed when we are not on a podcast. And
Sure.
and this one, then the final thing, which puts the real, like, yes, it is what I'm thinking it is. I actually do the cranial scan, and that is FCS only. Nobody else does that.
No osteos do this.
No osteo does that. This is FCS. So this is,
Osteos that are out there, challenge this man.
so no, they can come anytime. This is FCS specific. I can actually go and inhibit that, and
Yeah.
pretty good.
That's a lot less.
A bit tender there. Yeah. Okay.
Dave, you're gonna have a chat, me and you.
What the hell? That was there.
That's what I'm saying.
So that's his cranial scan, which confirmed that it is his oblique fissure of the lung.
So what's
To be specific.
what's the word? Wow. For it all being connected like that. Is it just anatomy? Is it-
Dexterity. So everything is connected. Fascia is all over your body. So fascia is pretty much when I'll give the example from Dr. A.T. Steele, again, founder of osteopathy. He said, when you step on a cat's tail, where does the noise come from?
From his mouth, right?
Right? So the noise come from mouth. And that's what his example was for the for the
That's an
osteopath.
interesting way of talking, saying it. It's true. Yeah, it comes from the mouth.
It comes from the mouth because, and there is no point in taping the mouth or putting a needle in the mouth or
Yeah.
putting a cup on the mouth.
Even hitting your elbow, you're like, ah.
Yeah. So the elbow is the issue, tail is the issue, not the mouth.
That's crazy.
That's how you look at the body and that's how you treat it. Otherwise, you're just treating what we call, you're just doing symptomatic relief. And that is not what osteopathy used to.
Wow. So there's not much kind of like data or science to back it up and say this is on the rise. It's kind of
Well, it's reproducible. The best thing about this is we can do it over and over again. I can do it. If Brian has a patient and I have a patient who was similar, we'll get the same results because Brian has taught, like, the good thing about FCS community, we don't hide any of the knowledge. We give it. So we actually do make sure that people get it because at the end of the day, it's the patients. And if you go to Brian's website, he used to have this, which is tuckypt.com. He actually had one of the guy. I mean, it's a life-changing treatment if you what he does. So tuckeypt.com.
that's crazy.
And he's got some of the
Davey, how crazy was that?
That was mad. Yeah, like literally feeling it move around my body almost like, well, you were redirecting it.
What
Yeah.
did it feel like, Davey?
Well, it was just the points of pain when you touched the first point. Where obviously, my shoulder could go, my arm could go back further after that first thing, but then it was where the pain disappeared from my arm, and then the pain disappeared from my back into my chest, and then from my chest after he touched up here, it was gone from my chest. So it just
you're
just
telling
moved
us
around.
live
No,
that you don't know this man.
No, I don't know this guy.
You've never worked with him, you've never seen him.
We're not a double act here. No,
That's
this is
actually incredible.
first time,
See,
yeah.
that is very, very incredible.
No, I felt it all, like all the pain just from 1 minute being there, and then the pain disappeared when he touched the other point.
that's the best part about it.
And this is true osteo. This is how it started.
This
off.
is how
and it kind of slowed down.
and yeah, now they are
Oh wow,
doing-
he's with Tony Robbins. Huh?
yeah, Tony Robbins actually do get treated by Brian and Tim. So Tim actually just I think he would have been with him last week or something.
Because he's a big guy, Tony, as well. He probably because he's such a unit.
Yeah.
Probably got a lot of
Yeah,
We'd imagine
so-
a lot of issues.
Well, what he does, Tony, what I've been told that he actually does seminars after seminars, and he's running in so many. he's
Oh yeah,
done-
it's non-stop. The guys,
Yeah.
yeah.
So you ought to have some kind of, and Tony actually wrote a book. I think it's called Life or something. I'm not sure. He just wrote a book, and he actually mentioned counterstrain as one of the modality
Wow.
he used because Brian gave him one of the study where one of the lady, she had an injury to the toe, big toe, and then they were gonna cut her toe off because it was going necrotic. And lady is a physiotherapist. She attended one of FCS seminar. Brian treated for about literally 5 minutes or 3 minutes, and went away.
Okay.
And MRI actually shows before and after that that necrotic kind of tissues were just gone for some reason, whatever that was.
You don't even know why that was. It just disappeared. Eh?
It just disappeared.
Wow.
But the thing is, we underestimate body's ability to heal.
Have you gone overseas and treated patients overseas?
Just the friends. So
Gone with them, or
well, I went to Pakistan, for example. I go to Pakistan because my family was from there originally, and I did treat a lot of people over there. Obviously, because there's no restrictions over there, so I could actually tell them it was more of a overall approach for a lot of the people, and a lot of people got really good results. And they had trigeminal neuralgia, lower back pain for many years and whatnot, and they had some of the pathologies, and some of the pathologies got better. I'm not saying that I'm treating pathologies. Now, don't get me wrong. That's not what I'm saying at all. What I'm saying is that if there is a lesion in the body, they perhaps, so if you treat that lesion, that will affect the body in a whole, as in maybe it will be helpful. So manual therapy has its standing with the other joint, like when you work as a joint approach, as a multiple approach, multidisciplinary approach, you will have the best outcome for the patients.
okay.
FCS at the moment, what I've seen, and I work with actually a few of the doctors, great doctors. I mean, they are amazing in their work, thorough, really good. And I'm talking about the GPs. I know it doesn't sound very, but very thorough, very good doctors. And they send me patients one after the other, and they get the results, and they're like, go see him. We are not sending you surgery before, go see him. If he says, then you go for it.
You see a lot of you probably see a lot of athletes in your practice, I assume, from day-to-day basis.
Mostly I'm actually seeing chronic pain patients.
Chronic pain.
So the athletes, because as I said, remember when you asked that why I haven't advertised anyway, the reason I haven't advertised anyway, because for a number of years, it was just me. Like for a few years, 3-4 years, and I was treating patients, and I was booked in for 4 or 5 months in advance.
Wow.
Tried working as hard as I could, didn't get anywhere because patients just keep piling up. So I actually had to. So when we started teaching to the students as well, these students are actually osteopaths in their own right. So now it's a little bit less overhead for me. So
Because it's very, very quiet. Like the like I said, I've seen so many osteos. I know so many osteos, and what you teach and specialize in, very, very quiet. It's very, and it surprises me that this was the original. This is how it started.
well,
and it's changed.
what we have done is Brian has come up with the tender points. And tender points is Dr. Jones came up with the tender point. Brian has enhanced their numbers. Tender point is the best way to monitor, as you noticed. It's the best way to monitor when I will treat, as you noticed you can actually make it to a mobile point where there's a little bit of a pulse, therapeutic pulse, and the inflammation kind of drain away. When you feel that, you see the entire, the whole thing is changing. The body actually changes and shifts. And then the next layer is presented to you to treat. So Brian has come up with a cranial scan. So cranial scan actually confirms it. But what we do, what he has done, we bring in touch inhibition, which is kind of like that you can see yes or no, yes or no. And that was what I was doing, yes or no. Is it your shoulder or is it something else? Is it your back or is it your forearm?
So with the cranial scan, then you'll be able to see sort of which nerves you see the message. The signal gets sent up.
Yeah. So you actually have with the cranial scan, you have the scan for the viscera, for the superficial fascia, for the arteries, for the spinal cord, for the brain, so you do inhibit all that to see where the issue is coming from. And it's very quick, as you noticed.
Yeah.
Very quick, and I just can do it very quickly and find this is your problem. This is what we're going to treat, and let's see what that does.
I'm still thinking, bro, about what just happened, Dave. Honestly, I can't think of any questions because my brain's frozen. You know what I mean? Like, you know when you say something for the
amazing. Yeah, it's amazing.
crazy. It was.
So
I've never seen anything like it either. Yeah, it's pretty pretty
Others in magic.
well, because I mean, what you know is osteopathy, what we know is, you know,
Yeah.
the typical sort of massages and your deep tissue massages and what people generally swear by, you know, that seems to take a long time as well, right? Like trying to repair the body in that way.
Well,
It seems to be this is a lot quicker.
so, I mean, I hope nobody takes it the other way, because I'm a Muslim and, you know, we do get pointed out for that. This is a difference between when you go for hunting to hunt with the shotgun or hunt with the sniper. So when you're using the shotgun will hit and miss.
Yeah.
You could or you couldn't.
And you have to be close up.
And you have to be close up. So you can so the better osteopath will get closer. With the cranial scan, with the touch inhibition, oscillation testing, functional tests.
Further away.
So
One shot.
it's one shot, one kill.
Wow.
Yeah.
You treat that tender point and massively shift the entire.
Yeah, it's worth explaining it.
And obviously there's potential for the person who say if they're doing the same things wrong, then it's likely to come back again. But
Right. So the coming back factor is factorial over here. So let's say if you were hit by a car and then we treated you and your inflammation went away and your pain went away. We hope that you don't get hit by a car again. Right. So, so your issue shouldn't come back. However, let's say if you're working on a computer and you got these because you're looking kind of like this eccentric posture or whatnot, then inflammation will start getting built up again.
that's right.
And then let's say month, 2 months, 3 months, 4 months, or 6 months time, you'll come back and you'll say, "Oh, I've got the same thing." That's because now it becomes a lifestyle which is affecting it. Now, if you're doing the exercises, stretches, and all the rest, you can actually delay it even longer. But each job has its hazards. Like I had one of the patient, he came in and he had a concussion, not from playing footy, but
Brain concussion.
yes,
Genuine.
so genuine one. So somebody actually, because he was at the side, and somebody dropped the hammer, which came from the
geez.
top and hit his head.
Wow.
And he had a concussion. I mean, no injuries because he was wearing the
He
helmet,
was very okay, yeah.
but
yeah.
concussion nevertheless. So, and he was his symptoms, pain all over the body.
Wow.
He had pain all over the body. Now, I checked his joint assessment. There was nothing wrong with it. His joints were perfectly fine. Range of motion was fine. So that's where you cause that the inflammation in the brain was actually causing that congestion,
In his whole body.
compressing and giving him pain all over his body.
Wow.
Because that's what
So the brain was pretty much bothered at that.
it was irritated.
Yeah.
So brain is like, oh, if I'm irritated, you're gonna get irritated.
Mm.
It will give you that. So we call it the central sensitization. That's a term that we normally use. It's somebody centrally sensitized, meaning they have. To remember one of the case that I had, one of my patient, she came in and she was having seizures.
Seizures.
Yeah. So she was having seizures.
That's a very serious problem to have as well with people, yeah.
And at the hospital, they couldn't find anything. They said, we can't tell you what's wrong with you.
Wow.
So ended up being, she came and somebody referred. So I treated her, and all I did was just the lymphatic works, arterial work, so circulation, blood circulation to the area. And she never had seizures after that. The husband used to bring me sweets after that because it was kind of like life-changing for that.
That's incredible. David, need the charge out here. Yeah, we can do. I'm blown away. You, obviously, you get some people at the gym. This is a question you probably know a lot about and deal with it. People that train at the gym, they come and train and they're on steroids. Does that affect, how bad, from your knowledge, do you feel like steroids use? Especially testosterone and all.
Testosterone or the steroids in general, let's talk about them in general. They lower your immune system. So from that point of view, of course, for aesthetics of the body, people are using testosterone. If you need them, I would say yes, use them. If you don't need them, if your body doesn't need them, don't put anything in there that it's not needed.
Okay.
So let's say if you have, everybody has different ways of going to the gym. Why they are going there, there are different thoughts process. So let's say if they're going to the gym, why they're going to the gym. if they are going to be fit and healthy and not showing off to someone, like, as in bodybuilding.
Yeah.
Bodybuilding is actually showing the poses and whatnot, and it's excellent work for health. I mean, from my end, when I had COVID, so I was in COVID ward for 18 days.
Really?
I was in coma, induced coma, because as soon as they put the ventilator,
That's a long time.
yeah, because the fluids were introduced to my lungs, and after that I caught influenza A, influenza B, pneumonia, and whatnot. The list was huge. All the ailments that I got from that. So they put me in induced coma, and then I think Dr. Howden, who was the head of the department at the time for the ER, really great doctor. He came up. He goes, "How are you doing now?" So they brought me out of coma.
Wow.
And I survived. Yeah.
Oh my God.
And when I came out, I was just bones, literally bones. There was no muscle left on my body at the time. The stairs that we took here, it would have taken me about 2 hours to climb when I came out of the hospital. So
45 kilos, 50 kilos? Less?
I've got no idea. I was bones.
How many days
in
were you in
bones.
total in coma?
18 days.
That's a long time.
Yeah.
Being in coma,
Yeah.
do you feel like you're aware? Do you remember anything being in coma?
Not really. People say that, that you see a lot of things. What I saw was just some broken roads and all that, but I think that's just normal.
It's
Now-
very interesting. I always think to myself, being in a coma, what does it feel like? What do we see? What do we experience? Does time exist in there?
For me, it's just a void. So kind of like
Darkness.
it's just I went in there. All I remember is the doctor speaking to me and saying that we are gonna put you in. We're gonna sedate you, and I'm like, okay. I think they sedated me, and then they get me to talk to my family, because they said that I was not talking right.
Incredible.
And so my wife said that, she sounded like you were not there. And I'm like, oh, okay. Isn't that normally how I sound?
Wow. So it's like a void.
Yeah, it was just like I wasn't there.
Do you still hear things? We still
You still kind of like I was aware when they were moving me from one bed to the other. I was aware of that. But then I think it would have taken over. And then when I came out of coma, all I remember is like maybe a couple of times, maybe they made me come out of coma because I was able to hear things, but not say anything.
it's like do you feel like it was a short trip?
Well, I got up and I'm looking at myself and I'm like, where am I?
That's
Because
incredible.
It didn't register.
Yeah, because I remember being in surgery once, and when they put you under an anesthetic and you go to sleep and you wake up, that wake up is like a small trip. You don't know where you were.
Yeah.
You were somewhere.
Yeah, I mean, the only thing I saw was, this is after the coma, I think, because the doctor, what they try to do is they try to ask you a question to see if your brain is still there,
Incredible.
because it can get affected for so long in coma. I mean, you might forget things, everything might not
Because
register.
the brain's not working.
Well, you're in sleep mode. So when you come out of it, what
no repeats.
can go wrong? Yeah, there are a lot of things that can go wrong. So I still remember the guy comes away. He goes, "Do you know what date it is?" I said, "No." And he goes, "Oh." I said, "Oh, yeah." I said, "Because I don't have a watch." So
Yeah. It's a good way of explaining it.
he laughed and he goes, "Okay, your brain is intact just because you still got the HEMA." I'm like, "Yeah." It was just incredible. So then from there, I went to. They told me that it will take me a good 2 years of rest to be able to get back to normal life and whatnot. I started training myself while I was in the hospital, and got myself discharged after 4 days after coming out of coma, because the hospital food.
And COVID did all this to you.
No, it wasn't COVID. I would say that it was more to do with the other diseases that I got hospital acquired. So they were resistant to the antiviral and antibiotics, obviously resistance. And that's why I went into coma, and because I came out of the coma, and ventilator did create a scarring inside the lungs.
Ooh.
Because one day I was training, I felt something was coming up from my lungs like this, and I coughed out this blood clot. Up until that day, my hands were shaking, my legs were shaking. Every time I tried to do any exercise or anything, it was shaking. That blood clot came out of the lungs, and I wasn't shaking anymore. Not sure what that was.
Incredible.
But I mean, my thinking is, where would have been that blood clot? Because if that's the part that was causing the shakes, that might be kind of like a pathology that is caused something.
Oh, yeah.
Like, you got to think that way.
It's incredible. It's incredible. And now you've like fully recovered now?
Yeah, no. I actually went to the gym. Thanks to kudos to Aziz. Fascial
Aziz, my boy.
Yeah, he actually.
He's a big boy, man.
He got me to do all the exercises.
Yeah.
And slowly, like from there, I was already walking and whatnot because I pushed myself. Because they said take a rest. So instead of taking a rest, I said I want to build up the muscles, and I want to go walking, and I want to do the other stuff. So
It's actually very important. I was listening to it on a professor was explaining, when you're sick, you actually need to be walking and exercising.
Yeah.
Rest is not good for it.
Rest, it goes both ways.
Okay.
If your body says rest.
Rest.
If you are resting too much, get up and walk.
SubhanAllah, the body
Yes.
is such a mechanism. The mind, the organs, everything, how we are constructed, it repairs itself, it thinks itself.
Yep.
It's like an engineer.
And well, Prophet Sallallahu, what did he say when you're sick?
Yeah.
When the sick person asks for something, give them. Because that's what their body wants at the time, period itself.
That's crazy.
Until it runs its course.
Yeah.
And then
Death.
There's no cure for that.
Yeah.
Right.
They're trying to come up with cures, but it's impossible.
I mean, some people are going into those cryogenics pods and whatnot.
Yeah.
Well, if anyone can find an answer to it, it's you, I think.
No. I can tell you that for sure there is no cure for that.
Yeah. I truly believe there will never be a cure for death.
No. There's that guy online who's been taking all those supplements, takes like 500 different tablets a day, and he's been trying to extend his life and like doing all this testing, like constant testing, and doing like everything to like the scientific
I think when your heart stops, that's it.
Yeah, it's. I mean, normally they try to tell you, this was wrong with the person, this was wrong with the person. Young person died out of nowhere. What's say? It's just the end of life. That was his time.
Yeah.
So you gotta.
Or touch base on you being a teacher as well a little bit.
Yep.
Being a teacher, you're still teaching now. What do you feel like is a big problem in the education system in high schools?
Well,
I feel like a lot of students are failing, don't want to be there, aren't connecting with school. We're seeing less academics. What do you feel like is a problem?
so I'm not teaching secondary education anymore because I used to before. Last time I taught was, I think, 2016, 2017. People say that it's a shift in the younger generation. I don't think it's just a younger generation. I think it's an overall system problem.
Okay.
Back in the days when I was teaching and I was treating the students as my own sons, as my own daughters. The reason was I wanted them to learn the best I had in my knowledge. So I would study before I go and teach them as well.
Yeah.
The reason was because you have to give them the best. Because how would you like if your son is being treated differently?
Yeah.
Not teaching, his teacher is not teaching properly.
Yeah.
So that was my main focus, that I want to give them everything that I had. And I still get those students coming up and saying, "Sir, how are you going?" And did you recognize me? It's like, you might have been, 3 foot or 4 foot, and now you're big, taller than me and bigger than me. It's like, I've got no idea who that is.
So it's very important that the teacher connects with the student.
And you have to connect with the real world. The students are getting bored because first thing they will ask, why I'm learning mathematics?
Oh, everyone,
Everybody will ask, why you're learning
a lot of people say
mathematics? So reason why you're learning mathematics is not just because, oh, you need to learn how to do 2 + 2. It also improves brain functions. It improves your problem-solving skills.
Problem solving.
It gets your, and part of the brain that we don't know gets activated, and it gets you somewhere else as well. So if you look at the golden age era of Islamic history,
1100, 1200 around then.
yeah, you have that golden era. They were proficient in chemistry, mathematics, astrology, and whatnot, and every single thing. They actually studied. The reason was not because, oh, yeah, you have to study this. No, and they studied more than one languages. Now, what do they say? If you want your brain to have more cognition and whatnot, what do you need to do? Learn more.
Yeah, learn more. Yeah, that's, you know what, initially when I started this podcast was for people to learn. The students to learn, educated, because I feel like the youth is being pushed away a lot, Syed, like very, very back, and they're very neglected. And I feel like they're not really motivated at school as they should be.
They need to, so in part of the students, it's also, I think, as a society, the fragment of family is broken away.
Yeah.
Which was...
Yeah, exactly.
So the entire system at the moment is not geared towards family oriented system. It is more towards how much tax we can get from the people. So
antisocial.
And it's very antisocial. If you look at it, the family coherence is not there. And the only people you see who are succeeding and who are getting better and better and better, there's family there. Because you have the support, family support network, you have the friends, and you. So if the more social a person is, the better his health is. Mental health issues is prevalent in becoming more and more.
Loneliness, right?
Loneliness. People are, let's say, people say, I've got 300,000 followers. Okay. How many people you communicate with? How many people you see when was the last time you went to the restaurant with your friends? In the school, the teacher is using all these new aids and whatnot. When did he last say that, okay, we are studying this because this. When was the last time they did that? And there are still teachers there. I mean, they truly believe that there are teachers who are putting in effort. And those you can see, students love them.
Yeah.
They love them because they're like, oh, some of my students, they became teachers. And I just always joke about with them. And I'm like, why did you become teachers? Didn't you learn from me?
Incredible.
And they go, no, we became teachers because they were inspired. Not just from me, as Mustafa was there, Bilal was there. And they wanted to make a difference. Now, what we are doing in the education department, and I mean, and they are really good in what they are trying to bring in the policies and whatnot. But I think somewhere along the line, the research has gone a little bit maybe sidelined. And the main purpose, because we need to be clear of what our goals are, what we are trying to teach these kids, what is the purpose? Are we trying to create people who are good for work, and so we can get the taxes, or we're trying to create a human society that is that the country will become really what it used to be. I mean, Australia going back 20, 30 years ago, and now, what's the difference you see?
Yeah,
it's huge.
Yeah,
right. The quality is just gone down.
But in the last 100 years, I guess Europe and around the world, here in Australia, the subjects haven't changed. We're still teaching the same stuff, more or less, than we were, say, 100 years ago, maybe just in a slightly different way.
Yep.
And
so that means that we have adapted to technology. So the kids grow up, they have a mobile phone and they have an iPad and whatnot.
Yep.
So what we did, we came in the schools and we start teaching the same curriculum, same content, just on electronic media now. But that doesn't mean that we have done anything to adapt to it.
No.
You gotta have something that is fascinating for the students to stay in the classroom. You have to come up, you have to give back power to the teachers to be able to discipline. I mean, but this is an overall thing. I mean, I have a friend who's in police and he was saying that crimes happen, right? They get the guys and the guys are out the next day.
Yeah. Not, not hard enough punishment.
And I think it's, I mean, the internet and, you know, the technology can really guide a lot of the young people into what they're really interested in, right? They're always going to follow what they're interested in. You know, the algorithm now makes that happen for them, you know? I was saying the other day, I was on a tram, and I saw a boy, he must have been about 13, 14 years old, and he was reading David Goggins' autobiography. You know, David Goggins, lunatic guy, but, you know, very driven, and the guy's a millionaire, and, you know, he's all about, he's a very driven individual, right? And a 14-year-old boy reading that book, you go, okay, how did he find out about David Goggins? Obviously online. And he's interested in this guy who's a motivational speaker. You know, he runs, I don't know how many kilometers every day, and, you know, makes millions on all these different things. And that's something that can guide. That kid's going to be driven to do something because he found that interest himself. I doubt the school went, hey, we should all read David Goggins. You know,
the school shouldn't be doing that anyway. This is this is the exception to the rule. Some people will go on their own, and we have to understand how the society works. But at the moment, the society fragment is falling apart, right? So the students are just they're just a reflection of it. Teachers, what do they do and how do they teach? What are they teaching?
It's not up to them, is it?
Yeah.
It's not up to them.
No.
The system is built and they just have to do what they're told, you know?
Yeah. So if you are doing something that you're told to do, where's going to be your passion?
That's right. Even the teacher.
Right?
Yeah. Yeah.
If I'm just told to do, because Brian said to do this, and I just do that, would I be passionate about what I do? No. I'm passionate about it because Brian said, we are going to do this, and the patient gets better, and we are getting the life-changing, and this is this. And then you see the patient actually motivating himself to do something about it. And as you change the entire concept of it, and then they see the result, this is like, yes.
So what's one change you'd bring into high schools today to, you know, shift that, change that, and make the students more motivated? You know, be it a new subject, be it, you know, producing different times, or?
I suppose what they need to do, most likely, from my point of view, rather than now doing the same subjects all the time, we put them into all the way up to year 10. Then we get them to specialize in some subjects. And up until year 10, 11, there's no competition.
Yeah.
Because everybody wins. That's a motto of nowadays, because if you don't win, then there is some problem with it, apparently.
You still get a prize.
Right.
Yeah.
No. Problem starts when you go to year 12, right? You have ETA.
Yeah.
So a lot of students, it's a huge stress. So now not everybody can get into where they want to, right?
That's where
So all of a sudden, these kids who have no concept of what they needed to do, or there was no competition, all of a sudden they are pitched against, there you go, now there's a competition. You do a little bit of mishap in that ETA, you're stuck for life.
That's insane. Yeah.
Unless you use the foundation level and then you go into the other courses and then you got to waste another 2-3 years.
Yeah.
Right?
Yeah. But when I grew up in the UK, and it's slightly different than, you know, you finish at 16 high school, and then you can choose to go to what we call sixth form or college, 2 years, and that's specialized, right? So you choose 3-4 subjects if you're one of the higher level students, but usually 3 subjects in the first year, and then you drop one and you go 2 subjects in the second year, and by the time you're 18, and then you choose something to go to university, right? And I didn't do that. At 16, I left because at 16, I didn't know what I wanted to do, and I was at the thinking at the time I didn't want to do one of the ologies that everyone else was doing, so, you know, psychology or theology or I was like, I'm not sure yet what I want to do, you know. So
most of the kids are not at 16. Most of the kids are not sure what they want to do. The reason is because the parents nowadays, we don't have time to talk to our kids and say, this is what you should be doing.
Yeah.
What do you think of this? We don't actually have time to spend to find out what our kids like. We've got no idea.
Yeah. And now they like a lot of stuff because there's so much technology that they're engulfed in every day. Yeah. There is a lot of things that they're interested in.
Yep.
It's like fact. Right?
So, you know, if you're born in a Peggy family, you're like, you know, sorry, that's not a nice thing to say.
We can start here.
if you're from Pakistani family, and it's like you're either doctor or an engineer.
No much choice, eh?
No, there is another choice, which is doctor. So, like that was the thing back in the days. Yeah, like my kids, when they were growing up, it's like, oh, what should you do? I said, oh, yeah, just become doctor engineer. No, I didn't do that. I actually asked them what they are interested in, what they want to do, and I put them the choices. This, if you do this, this is this, this is this, this is this.
I see.
And then look at it. Are they good in business? Go into business,
So you enjoy it.
right? Put them and give them some responsibility.
Yeah.
I remember when I was growing up, I think I was 13-year-old, and my uncle put me in the shop. Just for heck, I was studying. He put me in the shop. He goes, I said, what I'm going to do? He goes, just sit and learn. Watch, learn. And that's what I did. But back then they had time.
Yeah.
We don't have time.
Yeah.
Right?
Yeah, all the availability for jobs like that for teenagers to go into work. I don't know the rules here in Australia. I don't think they're legally allowed to work. I don't know, maybe there is part-time work that the 13, 14-year-olds can do. Yeah.
You can, if you are underage, you can work in McDonald's and Harry Jackson.
Yeah, sure.
Which gives you great skills, I suppose. That was sarcasm.
Well,
Making a burger.
you're making a burger, it's a skill,
It's like, this is the part I don't understand here. They can't work in any other place and call it a work experience. I think they go for a week. So you go to a business and work experience. So you go for a week and you sit there and you say what it is. Like one of my friend's kid, he came over and he wanted to be an osteopath or whatnot. And when he saw, he goes, "No, I don't want to do it." Good. At least you learn something.
Yeah, so you try it out and you go, not interested. Yeah.
Not interested. So, but that 1 week, it should be more than 1 week.
Yeah.
Sure.
Be able to get a good experience.
Get experience in where they want to go. You have the career counselors. The counselors are, it's one of the teacher who just wants some time off the other period. I'm just joking.
I mean, I had a work experience student with me a couple of weeks ago. She stayed 1 week with me, and I run a video production company, so we were doing video production. And I said at the beginning of the week, I said to her, by the end of the week, we would have filmed an ad for my company for a podcast advert, And I said, you're going to write it, you're going to script it. You're going to do the storyboarding, and then we're going to go out and film. You're going to film, you'll film me, and I'll do anything you want, anything you tell me to do, and then we'll edit the video together. And I thought that was really good because I set out the parameters at the beginning of the week, and by the end of the Friday at 4 p.m. when she finished, we'd finished editing the video, and we'd achieved exactly what we'd said we were going to do throughout the week. And
Just like that.
I thought that was the right way to do it and I showed her every single step, we worked through every single step, and I also just left it to her, you make a decision. What do you want me to say? Where do you want me to go? You want to go film at the park? You want to go film here? Whatever you want, and left it to her imagination and creativity, because I think that is another thing that the schools often kill is creativity.
Creativity, yep.
Make them challenge themselves a bit where they question and think what they want to do.
Yeah,
If you look at the education system, when was it developed the way we are at the moment? It was after the Great World War.
That's right. Yeah.
Right? So because we had that system back then, we needed workers. You don't need that much creativity. You need workers because there was not enough workers. So we created the work environment. That's fine. But now we need to move away from that model because we have enough workers. We just don't have enough things to do.
Yeah.
I find Australia a funny country, a very funny country in many aspects. It's just in many aspects. I was just comparing with one of my patients. He goes, "Oh, we are the lucky country," and I'm like, "In what aspect?" And he could not give me an answer.
Lucky because it's better, peaceful.
I said you were 10 minutes late because of the traffic outside.
Yeah.
I said, this is just 6 million people living in Victoria, 8 million, or let's say 10 million people living in Victoria, which is a huge size. And you have traffic congestion everywhere. You go to other countries, Europe and whatnot. I said, congestion is there, but it's not this bad. You're lucky, but I said, I can bet that the whole week that you spent, you hardly went out because of the traffic.
Yeah.
Yeah,
right?
Yeah.
It's crazy. It's crazy. We're definitely in a rough time.
I don't have a car. I don't I can drive. I don't. I live in South Melbourne, so I cycle everywhere because it's super easy to get around. And yeah, I think that takes a huge stress off your shoulders, not having to get in the car every day, drive around, and deal with the traffic. And look, I understand people's jobs; they have to. You know, it's not like there's an option around here. You know,
See, the other thing is,
you know,
one thing I've seen so I came from Pakistan. The politicians are very corrupt. It's a third world country.
Sure.
You can imagine how corrupt they are. I came here hoping that they will be a little better here. They're actually worse than that. We are not treated equally. If we look at, the fantastic guy we had as a premier, this is just going off the tangent a bit. Fantastic guy who, nearly had his statue built up in the city. So he put us into lockdowns, right?
Oh, yeah.
The economy is trashed. Now, and this is not just him. I'm talking about all the politicians. People said, no, Labour Party is bad, Liberal is bad, or this is bad, or the other one is good. And I asked them one question. Whenever there was a question of raising their pay in the parliament, which one voted against it?
No, none of them.
Yeah.
They all voted to raise their own salaries for sure.
Now, you're in media, right? So you have some kind of restriction or body that monitors you. We have some type of body, APRA, who monitors all the health practitioners. Who monitors the politicians?
Yeah,
They do. They monitor themselves.
Now, they raise their pay. They can get the pension. And while they're getting their pension, they can work because they're exempt from it.
and the rest of the country's suffering with loss of jobs and no money.
Yeah. No, if you are getting pension, you can't get pension if you have money, certain amount of money. But they can get the pension and they can work at the same time. I mean,
Yeah, so they can continue working to their
it's just like,
older years.
I mean, the mismanagement of the entire country is to an extent that it is unbelievable. I mean, Qatar, just give an example, got 11.3% of the world resources of gas, right?
That's a lot of gas.
That's 11. No, Australia got actually more than that. We got about 30-something%.
Wow.
So in Qatar, you get free education, free everything. We pay the highest bill for the gas, especially if winter is here. So we are paying $1,000 or something if you're running the.
Oh my God.
Yeah. So
Gas prices.
I think we got to get Syed on next time again and talk about that side and do a bit of those.
Politics, yeah, around it.
It's been absolute honor, Syed, having you, Dr. Syed, on today. Blow my mind the way he questions and his apples and science and
His magic tricks.
And I promise you guys, it's legit. There's no one knows no one here. It's the first time I met him. Dave is the first time here. It's blow my mind. It's no tricks. It's just science.
it is. Brian has published a paper, one paper, and there is a second paper. So I think on his website there should be a paper there. What I brought that was to actually show you how much of the changes you can see.
Yeah.
So there was one guy, he had his foot, I'm not sure if it is underneath. Yeah. He used to have a pictures there.
Is it what you want to the videos? Back to the videos?
No.
Back to where we are, yeah.
Here, if you go down all the way, he used to have these pictures.
We've got to get him on, him and you.
Who, Brian?
Yeah.
Brian will be here in 2 years' time.
Wow.
So if you look at this is just the how before and after. These are just the pictures. So go to the next one and you will see there.
Oh my God.
So this is the guy who actually fell and So vascular repair, inadequate blood flow. They were going to amputate his foot.
Oh my God.
And this is 12 sessions later. He just treated the entire thing. Amputation was off the table. And didn't have to do any of that. The next one is
Look at that.
9 days. There was a trauma. This Timothy Hodges, Tim actually treated her. And
That's a bad injury, man.
48,
48 hours after the treatment, it's all gone.
Yeah.
So what?
So
what
you can
happened
actually
to
see the watershed, right? So the watershed
Right,
lymphatics, if you can see the entire thing is just there.
What happened to her? Was it
A fracture.
Fracture?
Severe and
an injury?
injury.
Crazy
And that's
recovery,
yeah.
man.
So that's
Jeez.
and
Eyes, pupil dilation.
yeah. So
Oh, concussion.
Guys even doing eyes.
well, it's a lot of it's inflammation. Like you see,
crazy.
a lot of the stuff happened because of inflammation.
When's he coming back? Where's he overseas now?
Well, he's in US.
Okay.
Because that's where his main thing is. Tucky and Associates. He's from
That's where Tony
Yes.
Robbins is.
Yeah,
Same
Tony
pays him, so that's where you need to be.
When he comes down, we're gonna get you on him on. That would be a double magic show. Incredible.
Wow.
Yeah,
It's incredible.
So that's Brian and Tim. They're asking questions. They started to develop something. Before we weren't very open about sharing all the things that what we are doing.
Now you
Now because we start having more students, so we have a little bit of breathing space that we can actually.
What
say,
was the fear in that, like sharing all this knowledge?
So let's say in Australia, like in Melbourne, when I was doing Fascial Counterstrain, we had about 1, 2, 3 3 people. So I had myself, Adam, and Adam Odoritis. He's an osteopath too, and Unchained. So 3 people in Melbourne who were training using this technique. Then, considering how many people are there, if you start explaining, like you start marketing, you can imagine what will happen.
yeah.
You'll be overwhelmed. So now we have
Right, it's the same.
good-
Take your time. Yeah.
So we developed the team. So we now have a good amount of students that can take the pressure off. So now I'm happy to say that, okay, we can actually share and we can say that this is what we're doing.
It's crazy.
And now the biggest challenge will be from the other osteos, I suppose.
Yeah, yeah. To hear it and it's an absolute privilege and honor to have you on, ladies and gentlemen, Dr. Syed. If you want to go on the website and show his website,
Is it this one?
yep,
The Complete Osteo is the other website that we had for the clinic.
that's his.
This is where we do the courses. So this is for the practitioners if they want to do it. CompleteOsteo.com. So it's one word, completeosteo.com.au.
So this is his website, ladies and gentlemen. If you want to hit him up, need any help, fixes, crazy stuff, you need repairs, this is the man to come to. And
It's a very generic kind of website. We don't have any
that's it,
fantasies.
just basic.
Just basic.
But it's an absolute
Just-
pleasure to have you on, Syed, and I appreciate Aziz for setting this up. And inshallah, in the near future, we're going to have you on again and go for round 2
Inshallah.
because
Anytime.
you blew my mind with everything. It's
was
actually
amazing. Thank you
incredible.
so much.
I really appreciate your time.
Anytime.
And I just want to thank you for your time.
Inshallah.
And yeah, that's it. I appreciate it. Thank you so much.
Thank you for both
Thank
of
you
you
so much.
inviting me.
All right.
That's an honor. If if you guys want to book in any appointments with him, that's the man.
And my team is there too. So
Scott down
Dr. Magic.
Yep.
His name is.
name's not Dr. Matches.
Yes, his name is Magic.
We get make this up, man. Make this up.
It's crazy.
So that's his name, Gus, Jonathan Booth. He is the Thai, and he's there, and Chris.
amazing.
So this is my clinic. So
Amazing.
all of them really good.
You guys know how to find him. Yeah, give him a call, make a booking, and get your issues resolved mentally, physically, and spiritually, everything.
There's only one problem we have over there, and that's Mickleham Road traffic.
Oh,
There you go.
There you
See
go.
all over Victoria. Right?
Thank you so much. Thank you. Oh, this was amazing.